Hi, my name is Kay McDonald, and I decided to do my senior study on spinal manipulation for low back pain. So, just some general stuff about low back pain. It does affect both the athletic and non athletic populations. It is very challenging to treat, not only through my personal experience, but through other clinicians as well. And then for back pain to be considered a chronic ordeal, it has to be lasting longer than 3 months. 85% of the adult population have been affected by this or are being affected right now. And it is one of the most expensive things for companies around the world to pay for just because of workers' comp and everything, because the back pain of the employees is so severe. So for the rehabilitation process for low back pain is mainly focused on the core stabilization. And so there hasn't been a whole lot done for the spinal manipulation in like a clinical setting. Um, but basically, the main focus was the core stabilization and to strengthen the muscles around the spine just to make sure that it does get the support that it needs. And rehab is not a 100% end all be all for low back pain. So for spinal manipulation, it's more common than we think. Um, a lot of the times we will pop our back out of habit, or we could do our knuckles, our neck, or whatever else pops. And that's basically what spinal manipulation is to a certain extent. Um, so basically, what that is like that pop that you hear is known as cavitation. And what's going on is the synovial fluid within that joint capsule is moving around, which does increase joint nutrition, and it also can stimulate some blood flow and bring in the good cells that you need in order to help heal that joint the way it needs to be. But so basically, what I want to do with this is see how it does on or how back pain reacts to spinal manipulation. So some things that it can be used for are degenerative disc disease. That could be for any age. I just happened to find a study for people who are 60 and older. And then basically, there's not like a golden timeline for when spinal manipulation needs to be performed. It kind of can be like as it's needed. Um, so some more conditions are acute and chronic low back pain. Uh, and so basically, it's trying to decrease the amount of pain that the patient is experiencing. And then again, like I said earlier, it improves the joint nutrition and stimulates blood flow to that joint area. So now we're going to get into the meat and bones of this, and I'll talk about how to actually perform spinal manipulation. So the patient will be laying on a side of their choice because we'll do it on both sides. So it doesn't matter what side they start on. And then what you're going to do is you are going to pull the shoulder that is down on the table to where their back becomes more parallel with the table and almost flat. And then um, once you get them into that position, you'll just fold their arm across their chest to make sure it's comfortable. And then you're going to feel on the spine and basically feel for the space in between the vertebrae of the lumbar spine, and you're going to take their top leg and then bend it. And then once you feel that space kind of open up just a little bit, you're going to stop the leg where it is, and then you're going to hook the foot around the bottom of the leg. And then that is the position they need to be in. And then as the clinician, you are going to put your closest leg on top of their bent leg that's hooked. And then with your top hand, you're going to put it on the opposite shoulder that you adjusted from the beginning. And so it should not be on the table. It should be the shoulder that's furthest away from you. And then with the other hand, you will place it on about this area of the sacrum. And then from that point, you will tell the patient to take a deep breath in and then let it out. And then about halfway through, you will deliver the spinal manipulation treatment. And so basically with that top hand, you're going to push that shoulder down towards the table. And at the same time, your other hand and your other leg are going to move in the same direction, and it should move in the direction that their leg is pointing, the bent leg is pointing. And then it doesn't have to cavitate for it to get the effect. Cavitation is mainly just like that sound you hear, but the synovial fluid still does move around and it still does stimulate the blood flow. And then once that happens, then you'll tell the patient to flip over to their other side, and then you'll perform the same thing. And then again, this is just more in detail about everything that I explained. So this is a form of conservative treatment, obviously. Non-conservative treatment is like a form of surgery. And so conservative treatment is always going to be the first option, basically, no matter where you go. Mainly, the doctors will refer you to physical therapy to try and rehabilitate the back and the core muscles in order to try and see if that will help the pain. If it does, then they can also give you more visits to go to the physical therapy place, or they can change their treatment plan and say, okay, maybe this person does need the surgery and that might be able to fix their problem. But basically, like with the physical therapy treatment, they're able to use all sorts of modalities that I have listed, like the e-stim machine, heat packs, ice packs, and traction machines. And then obviously the most common is the heat plus the e-stim, just because that normally gets the patient feeling good in order to be able to do their rehabilitation exercises. But that does not solve the underlying issue. It's just like a quick fix to take away their pain for that little bit of time. Injections are also an option for this in the conservative treatment. There are PRP injections. So basically what those are is, it stands for platelet-rich plasma. There's been some research on them. I did not find anything that was too convincing on them. They were very expensive and they just haven't had a whole lot of success from the research that I have done. But there's also like epidural injections or steroid injections. And so those are basically the ones that they will go to in order to help take that patient's pain away and get them to be able to function like they need to be on a daily basis. And so this is the uh, injection that I was just talking about. And so it's the epidural injection, and then they basically insert it into the facet joint wherever they're having pain. And what it does is basically kind of numbs that area. And so after those options have been explored and it hasn't worked, a surgical procedure might be in order at that point. And so there are several options for surgeries. Here's a list of them that are like the most common. And um, spinal decompression was the one that was most common for the lumbar pain. There's obviously different things that cause low back pain. There's not one surgery that's going to fix every single back problem. That's why there's so many of them. Um, so basically, there was a study done and it looked at spinal fusion along with decompression. And what they came up with in that study was that that would probably be the best option for most people. They also had a different test group where they just performed either the spinal fusion or just the spinal decompression. And although it did have decent results, they feel like if those two were put together, that it would be the best thing for those patients. And here are my references.